Hello everyone, my name is Dr. Kijsirichareanchai, an internal medicine resident from Texas Tech University Health Science Center, Lubbock, Texas. Today I'm going to talk about our study that will be presented at Digestive Disease Week 2011 in Chicago, entitled The Impact of Standardized Order Set on Physician Adherence to AASLD Guideline for Patients with Cirrhosis and Acute Gastrointestinal Bleeding. Variceal bleeding is a major medical problem leading to significant morbidity and mortality in patients with cirrhosis. Therefore, American Association for Study of Liver Disease, or AASLD, launched a practice guideline in 1997 with an update in 2007 to help us manage this patient. The recommendations include, number one, the use of antibiotic prophylaxis for spontaneous bacterial peritonitis. Number two, the use of somatostatin or its analog. And number three, early GI consultation for upper endoscopy within 24 hours. However, the recent survey and also our retrospective data show that these measures were underutilized. Our problem is how we can improve our quality of care in this type of patient. One way to do is to use the standardized order set. The standardized order set is a list of orders created based on the latest recommendation and guideline. It has been shown to improve quality of care and also reduce medical errors in various medical conditions, including stroke, acute myocardial infarction, and also community-acquired pneumonia. However, the impact of standardized order set on patients with cirrhosis and acute variceal bleeding has never been evaluated before. So we would like to see if we created our own standardized order set, if this would make any difference or not. So we created our own upper GI bleeding standardized order set and implemented in our hospital on October 1st, 2009. Based on the latest recommendation, our standardized order set include, number one, basic labs such as CBC, comprehensive metabolic profile, PT, PDT, INR, early GI consultation for upper endoscopy, and also specific management approach, including the proton pump inhibitor, infusion of bolus. For patients with suspected variceal bleeding, the order set also include the use of octreotide infusion and also antibiotic prophylaxis regimen, for example, ciprofloxacin or ceftriaxone. We then compare the use of antibiotic prophylaxis, the use of octreotide infusion, and also early upper endoscopy before and after the implementation of this order set. We would like to see if this order set will improve our physician adherence to standard practice guideline or not. So the baseline patient data, including the demographic, disease severity, and comorbidities, were similar in both groups. As you can see from the table, the use of antibiotic prophylaxis improved significantly from 22% to 76% comparing before and after the implementation of this order set. We also observed some improvement in terms of the use of octreotide infusion and also upper endoscopy as well, although this number were not statistically significant. In conclusion, this standardized order set improved our physician adherence to standard practice guideline from AASLD, especially in terms of the use of antibiotic prophylaxis. We also believe that this standardized order set help educate our physician about current guidelines for the management of liver disease as well. In the future, we would like to see a larger study with longer study period to see the benefit of this order set and on the cost of care as well. For more information or any suggestion, please feel free to contact us at this email address. We would like to see everyone at our poster session at Digestive Disease Week. Thank you.